Hello everyone. Today's video is about a treatment called prolotherapy combined with ozone therapy to help with musculoskeletal pain conditions. Just before jumping into the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. I decided to put this video together because, or talk about this topic in this video because I've just had a couple of cases earlier today and another one yesterday who are just doing so well with this treatment called prolotherapy. If you've never heard of prolotherapy before, it's this therapy. It's actually been around for about 100 years. It's much more refined now than it was once upon a time, but it was first used in the around 1910 or 1912 or something like that. And basically, it involves injecting an irritant into damaged tissue, which at first sounds very counterintuitive. Why would you do that? But it turns out that when you inject an irritant into damaged tissue, it activates a lot of growth factors in the area, and that leads to tissue healing. Unfortunately, certain tissues in our bodies do not have a direct blood supply. They have a heart, they're more prone to injury, and they take a longer time to heal. And those tissues include ligaments, tendons, and the inside of our joints. If you think about it, most people probably don't think about this, but I think about these things. If you think about it, person who's say above the age of 50, it's kind of hard to find someone nowadays, unfortunately, at least in our, at least in North American society anyways, I'm sure in other parts of the world as well, where somebody above the age of 50 doesn't have some joint that's bothering them, or doesn't have some sort of a body part that's bothering them. It's either, I've got something in a knee, or I've got some arthritis on my knee, some arthritis on my hip, or, oh yeah, I strained that rotator cuff tendon, 5 years ago and it's never fully, 100% healed up, or, oh yeah, I sprained my ankle, multiple times, kept spraining the same ankle playing soccer or some other, type of sport. It's relatively rare for there not to be some ligament, like a ankle ligament or a wrist ligament or something like that, or a tendon like rotator cuff tendons being common ones that can be injured, or a joint like knees and hips and low backs and whatnot that again, folks above say the age of 50 or so don't have some issue with. Of course, there are people under the age of 50 that have issues with their joints as well, but the take-home message is like, well, why is it that these joints, these ligaments, these tendons are so prone to injury? You don't hear about people saying like, oh yeah, like just my bicep muscles kind of wasting away over here, like, oh yeah, I'm like kind of losing a little chunk of my liver or something. We don't have the wear and tear in other body parts the way that we do in our ligaments and tendons and joints, and that's because they do not have a direct blood supply. Ligaments and tendons are basically tethers of connective tissue. They don't have blood vessels that go to them and feed them. Our joints don't have a direct blood supply. The nutrients that get into our joints are basically nutrients that are diffused from the blood vessels inside of our bones across the cartilage and then into the interarticular space. So the reason that's important, or why that matters, like, well, okay, blood supply, tissue injury, like what's the link there? Well, one of the functions of our platelets, the little blood clotting factors in our cells, is to bring growth factors to damaged tissue. So when there's damage somewhere, then platelets come along, they express their growth factors, and then healing occurs. We don't get that benefit for our ligaments or tendons in our joints. So if those tissues are damaged, then it's hard for the body to heal them fully, or to kind of keep on top of the maintenance of those tissues to get things 100% back on track. So we can use treatments like prolotherapy to bring growth factors to the area by saying, oh, this say this rotator cuff, my supraspinatus tendon was injured. Well, and it's just not healing up, or it's healing up too slowly. Well, we inject this irritant, and most folks, most clinicians nowadays who use prolotherapy inject dextrose. The other name for dextrose is glucose. It's always a little bit funny to talk about sugar injections, but it's a high concentration of sugar. And so it's markedly higher than, say, the concentration of sugar that we would have just floating around in our bloodstream. It's generally about 5 times higher than that concentration. And so the dextrose in this case is injected usually along with some anesthetic like Procaine or lidocaine, just a locally acting anesthetic, and then that irritates the tissue, and then it causes these growth factors to be released, and then the healing starts to occur. prolotherapy injections don't work overnight. I mean, for some patients, they do. One of the patients that I just followed up with felt better by like 2 days post-injection. That's wonderful. And in those cases, it's usually, in my experience, to my knowledge, usually because of the anesthetic that's being injected that leads to that improvement. But then, so sometimes folks will feel better for a day or two after the injections, then that kind of, the honeymoon is over. But then usually it's around the 2-3 week mark after the injection that the growth factors have had enough time to build up, and then we start seeing those clinical improvements. Luckily for this guy, felt better within a couple of days, and then there was sustained improvement, over the ensuing few weeks. So anyway, sometimes folks get lucky in that way and have a benefit right from the get-go, but usually there's a 2 to 3 week delay before things start to feel better. It's not like a cortisone shot where you do the injection and the inflammation just kind of magically evaporates, very, very quickly. It takes a bit of time for those growth factors to actually heal things up. So with prolotherapy, I mentioned at the start of the video that prolotherapy combined with ozone therapy, based on my clinical experience, seems to be quite a lot more effective than prolotherapy by itself. There are a few research studies where they've actually compared prolotherapy by itself versus ozone therapy by itself versus prolotherapy plus ozone together, and the outcomes in the prolotherapy plus ozone group are better. Interestingly enough, when you add ozone into the mix, it actually helps to improve the tissue architecture of the healed up tissue. They've done a really interesting study. I mean, it's sad because they did this on rabbits that were ultimately killed for the purpose of this study, so sad from that perspective, but with animal studies it lets us learn a heck of a lot more about the mechanisms of action behind these different therapies. And so anyways, they basically injected these, so they induced a tendon injury, so I believe it was a rotator cuff injury, so they basically damaged the rabbit's rotator cuff tendon, and then they either let the tendon heal up by itself, or they injected, in this case it was a platelet-rich plasma therapy, so PRP for short, which is kind of related to prolotherapy, but a stronger version of prolotherapy. And then with some of them, they injected just PRP, some of them they injected PRP plus ozone, and the rabbit tendons in the ozone group had tendons that after they got all healed up, they then sacrificed the rabbits, looked at the healed up tendon, and the tendon looked just like a healthy tendon, like almost 90% as healthy as a regular healthy tendon. So strong, healthy, just looked like regular tendon tissue. The tendon fibers were in like a really healthy trajectory, whereas in the post PRP group, the tendon fibers were healed up. They were stronger. They were looking good, and they were looking strong, but the trajectory of those tendon fibers, that you could tell that it had been a previously injured tendon. The fibers were kind of like crossed hatch and just not having the sort of normal sort of structural kind of elasticity, the normal structural appearance of a regular looking tendon. So there's something quite interesting about ozone being anti-inflammatory in and of itself. It promotes tissue healing, but there's just something special about it where it seems to signal those cells to just heal things in a very, very thorough, comprehensive way. So when I talk about prolotherapy, to be perfectly frank, in my clinical practice, I've really only ever done prolotherapy plus ozone therapy together. So I've seen really good results in my practice, by and large, with prolotherapy plus ozone. And so if folks, listening to this are thinking like, I had prolotherapy and it didn't work, don't get me wrong, prolotherapy by itself can work well. But if folks are listening to this saying, I had prolotherapy and it doesn't sound quite as good as what Dr. Raid's talking about here, well, it may be because that ozone is the missing piece of the puzzle. What I've heard from other clinicians who used to do prolotherapy, sometimes for many, many years, and then they added ozone therapy into the mix, it's very rare to not hear a clinician say that ozone didn't make a significant difference, making their therapeutic outcomes quite a lot better, faster results, better tolerated treatment, ultimately needing fewer treatments to get to the same final endpoint. So prolotherapy plus ozone can be very helpful, again, for joint issues. One of the patients I was referring to had this neck joint issue, one treatment, feeling markedly better. So it was really great to see that one this week. Patient that I mentioned earlier is a back pain issue, thoracic spine issue, markedly better. Another patient with a knee joint, markedly better. So, helpful for ligaments, rotator cuff issues, other tendon issues, joints. Lots of clinicians out there do prolotherapy. Lots of clinicians out there do ozone therapy. Quite a few of us do both of them together. So if you're experiencing musculoskeletal pain, chronic pain, it's worth perhaps asking your clinician if that's a therapy they offer. Maybe they could refer you to somebody locally who does that. So I hope this information was useful. If you have any comments or questions on this topic or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.